A follow-up tonight on the Kentucky family we told you about recently that was facing a huge increase in its health care premiums under Obamacare. A recent piece on the New Yorker website suggested the family would actually save money by enrolling in the health care exchanges. Tonight, the official numbers are in. Here's Chief National Correspondent Jim Engel.
Andy Mangione, who lives in Kentucky with his wife Amy and their two boys, is doing the same thing millions of people are doing, trying to figure out how much his insurance will cost under Obamacare. Before the exchanges opened, his insurance company said his rates would soar, but now there are subsidies, and he's been trying to find out for days how much he'd get.
To logically compare plans. I've been calling them every single day since October 1st, several times a day on some occasions. They've been sometimes enduring 45-minute holds, 50-minute holds, half an hour holds.
Though Kentucky officials were unable to give him a firm number on his subsidy because of repeated IT problems, they did refer him to the Kaiser Family Foundation site, which suggests his subsidy will be $414 a month on a premium of $868.
What I'm concerned about is our doctor's visits and our emergency room visits and what I'm paying in my premium.
The problem is that's a 24% increase over his current payment after subsidies, and his copay for emergency room visits almost tripled from $125 to $350, an important factor for a family with two young boys.
They're climbing trees, they're falling out of trees, they're running around, they're falling off their bike. They're very active. They're not unlike any other, 8 and 10-year-old boys.
Nasty falls, head gashes, and the like mean ER coverage is important. The Mangiones found one plan with smaller premiums, but their doctor was out of network, ultimately making it more expensive for them. They're not the only ones with sticker shock. Members of Congress also say constituents have been complaining as they read some of the letters they're getting.
I remember our president saying the new health care bill will reduce costs. I have my health care renewal forms, and the premium has increased about 15%. A $700 deductible is added, and my copayment is increased.
Mike from Hickory saw his premiums rise from $388 to $650. Phil from Forest City saw an increase, even though the policy was unchanged, saw an increase of 42%.
Some Fox viewers in Alabama also wrote to us, though they asked their names not be used. This couple, around 60 years old, sent detailed information about their rate increases, which will add 82% to their annual health care costs, and their deductibles increased by a third. As far as the rollout is concerned, Republican Senator Pat Roberts said today that the problems with the exchanges are systematic, profound, and indisputable, as he called on HHS Secretary Kathleen Sebelius to resign for what he called gross incompetence. Brett?